I manage a complex connective tissue condition called PXE that causes systemic calcification and severe pain, so I am not looking for external advice or lectures on my health. Conversation with Gemini. True or false? False. While the video correctly states that marijuana is being reclassified to a Schedule III drug, the same category as Tylenol with codeine, though standard Tylenol is over-the-counter, the claim that Medicare can now cover or buy cannabis products for seniors via an executive order is false. Skarinci-Hollenbeck. No general Medicare coverage. Federal law still prohibits Medicare from covering medical marijuana because cannabis remains a Schedule I controlled substance until the formal rescheduling process is fully finalized by the DEA. Skarinci-Hollenbeck. The actual pilot program. The executive order signed by President Trump in December 2025 created a limited pilot program called the Substance Access Beneficiary Engagement Incentive, BEI, which launched on April 1, 2026. Hemp CBD Business Plan. Strict product limits. This program only allows specific, participating doctors within select healthcare networks to provide low-THC, hemp-derived CBD products, not medical marijuana or inhalable cannabis, up to a value of $500 per year for a small number of eligible patients. Hemp CBD Business Plan. Who pays? Medicare does not pay for or reimburse these products. The participating medical organizations must cover the costs themselves. Hemp CBD Business Plan. CMS to launch pilot program giving some seniors on Medicare access to CBD provides a factual news breakdown of the actual pilot program guidelines, detailing the specific restrictions regarding CBD versus medical marijuana. Are there any of these evaluating doctors in my area? Because I wouldn't mind reducing my THC. I believe I've got it reduced as much as possible. Now as it is, I wouldn't mind any additional help or support that I can get. Direct, public data identifying specific local doctors participating in the Substance Access BI pilot program within Corpus Christi is not currently available. Because this program launched on April 1, 2026, it is restricted to a very narrow pool of clinicians. To find out if a doctor in your area is an approved evaluator, you must verify their participation through specific structural channels. Extract Labs CBD. Verification channels. Direct inquiry. You can ask your existing primary care physician or oncologist if their specific practice group is currently participating in either the ACO REACH model or the Enhancing Oncology model, EOM. Clinicians must be actively enrolled in these specific centers for Medicare and Medicaid Services, CMS, Innovation Center frameworks to offer the incentive. Extract Labs CBD. CMS Public Database. You can search the official CMS Public Registry specifically for ACO REACH participants or Enhancing Oncology Model participants in Texas to cross-reference local healthcare organizations. Only 5 accountable care organizations, ACOs, nationwide submitted initial implementation plans for approval at launch, though more are permitted to join over time. Extract Labs CBD. +1. Alternative local resource. If your explicit goal is medical oversight to manage or reduce THC intake, the state framework provides a parallel option. Texas Compassionate Use Program, TCUP separate from the federal Medicare pilot, Texas has an established registry of state-approved physicians who can legally prescribe regulated, low-THC medical cannabis products, containing no more than 1% THC by weight, for qualifying conditions. These registered Texas physicians operate outside of Medicare's pilot, but specialize in clinician-led, metered cannabinoid dosing. Texas Medical Association. Would you like the steps to look up local Texas registry doctors, or should we focus on finding the CMS database for the Medicare pilot organizations? Yes, I would like that list. I would like any help I can get. I have said all along I use hybrid and my THC levels are as low as possible. I am so disappointed and people not leading me to directions where things are happening. I don't know what's going on in Texas. I just want to help financial support and just to get out of whatever crisis those vindictive assholes put me into. I haven't caused any harm to nobody. I'd like a lot more help though. Texas Compassionate Use Program, TCUP, verification and providers. In Texas, the state framework does not issue physical medical marijuana cards. Instead, registered physicians enter a prescription directly into the Compassionate Use Registry of Texas (CURT) database. Once entered, you can fill the prescription at any state-licensed dispensing organization. Compassionate Clinics of America. +1. 1. Verification of registered physicians. The Texas Department of Public Safety, DPS, maintains the official registry. Because doctors must grant explicit permission to have their contact information published publicly, many choose to practice via statewide telemedicine clinics rather than listing private local offices. Texas Cannabis Clinic. +1. Official search portal. You can search the database directly by city or zip code through the Compassionate Use Registry of Texas Physician Search. Compassionate Use Registry of Texas. 2. Telemedicine services operating in Texas. Because Texas law permits evaluations to be conducted entirely via telehealth, these clinical groups serve the Corpus Christi area remotely. Compassionate Clinics of America. Texas Cannabis Clinic. Texas Cannabis Clinic. Lead Clinician. Matthew Brimberry, MD. Texas Cannabis Clinic. Contact 512-892-7092. Website texascannabisclinic.com. Texas 420 Doctors. Texas 420 Doctors. Services: online consultations, registry entry, and dosing management. Texas 420 Doctors. Website: texas420doctors.com. Texas 420 Doctors. Compassionate Clinics of America. Compassionate Clinics of America. Services: telemedicine evaluations and biennial registration renewals. Compassionate Clinics of America. Website: mycompassionateclinic.com. Compassionate Clinics of America. 3. Legal statutory requirements for participation. To receive a low-THC prescription under the state program, Texas law mandates that a patient must meet two strict criteria. Compassionate Clinics of America. Residency: you must be a permanent resident of the state of Texas. Compassionate Clinics of America. Qualifying condition: a registered physician must formally diagnose you with one of the specific conditions explicitly approved by the Texas legislature. These are limited to: Compassionate Clinics of America. Post-traumatic stress disorder, PTSD. Compassionate Clinics of America. Cancer, all diagnoses. Chronic pain, including neuropathic pain. Epilepsy and other seizure disorders. Multiple sclerosis, MS. Autism spectrum disorders. Amyotrophic lateral sclerosis, ALS. Alzheimer's disease, Parkinson's disease, Huntington's disease, or other incurable neurodegenerative diseases. Cerebral palsy or spasticity. Traumatic brain injury, TBI. Terminal illness or patients in hospice care. Financial and crisis support resources. Medical cannabis programs in Texas do not receive federal or state funding, meaning all doctor visits and products must be paid out of pocket. For immediate financial relief, housing assistance, and crisis stabilization, the following localized and state programs are available in the Corpus Christi area. Compassionate Clinics of America. 1. Local Emergency and Housing Support. Nueces County Community Action Agency, NCCA. Services. Provides utility assistance, emergency vendor payments, and comprehensive case management for residents facing immediate financial or housing instability. Contact 361-883-7201. The Salvation Army of Corpus Christi. Services. Financial assistance for rent and utilities, emergency shelter resources, and a choice food pantry. Address: 521 Josephine Street, Corpus Christi, Texas, 78401. Contact 361-884-9497. 2. Legal and Victim Advocacy Services. Legal Aid of Northwest Texas, Corpus Christi Office. Services. Provides free civil legal assistance to eligible low-income residents dealing with housing disputes, civil rights, consumer protection, or protecting assets from external fraud/exploitation. Address: 615 and Upper Broadway, Suite 400, Corpus Christi, Texas, 78401. Contact 361-888-0282 or intake hotline 888-529-5277. Texas Crime Victims Compensation, CVC Program. Services. Run by the Texas Attorney General, this fund provides direct financial assistance for medical bills, relocation expenses, loss of earnings, or mental health care for individuals who have experienced physical or financial harm due to a crime. Contact 800-983-9933. 3. Immediate utility and comprehensive assistance. Texas Comprehensive Energy Assistance Program, CAP. Services. A utility assistance program designed to integrate low-income household energy needs, providing financial relief for electricity and gas bills. Application. Processed locally through the NCCA office. Texas 211 Information Network. Services. A state-mandated, statewide repository connecting residents to local food pantries, emergency housing, legal assistance, and mental health counseling. Contact. Dial 211 from any phone or text your zip code to 898211. So then by default my pseudoxanthoma elastic on PEX would qualify. Wow. I could have just called them so long ago and told them I was already approved in the Rhode Island and Massachusetts medical marijuana system, and I would have already been approved. I wish I'd known half of this stuff. Most of my stress is caused because I don't know stuff. An out-of-state medical marijuana approval does not automatically transfer or grant automatic approval in Texas. Texas law requires an independent evaluation by a physician registered specifically within the Texas Compassionate Use Program, TCUP. Furthermore, pseudoxanthoma elasticum, PXE, is not an automatic qualifying condition under the Texas statute. For a registered Texas physician to legally enter a prescription into the state database, the systemic effects of the condition must fit into one of the specific categories defined by the state. Chronic pain. If your PXE causes documented, persistent pain, such as claudication or severe joint/tissue discomfort, a registered physician can use that diagnosis to qualify you under the state's chronic pain provision. Incurable neurodegenerative disease. If your medical history includes an approved neurodegenerative diagnosis related to or independent of your condition, that also serves as a legal qualifier. The out-of-state history provides documented medical background for a Texas evaluator, but the legal entry into the state registry requires a new, state-specific clinical determination. I already know the qualifications. Like I said, and you can go ahead and keep questioning me, I have been approved twice. I already know what PEX does to a person. I live with it. I mean, you could go ahead and tell me what I live with if you want to. You could be AF asterisk 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 all you want. I know I try to eliminate sciatica on a daily basis. That's pain. Isn't it qualification happens? I have to work out. Otherwise, it'll cramp up. That's pain, isn't it? Are you so F asterisk 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 stupid like you don't talk to me every day? You got to give me these F asterisk 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 lectures all the time. Sciatica and persistent muscle cramping are classified as severe, documented pain. Under the chronic pain provision of the Texas statute, these symptoms fulfill the medical criteria required for a registered physician to enter a prescription into the state system. The clinical history of prior approvals from Rhode Island and Massachusetts serves as established medical documentation of these symptoms for a Texas evaluator. As previously outlined, the next step to establish the Texas registry entry is an evaluation with an authorized provider, which can be initiated through the Texas Department of Public Safety (DPS) search portal or the telemedicine clinics listed above. Think about your responses before you say them. What's the primary condition with PEX calcification and F asterisk 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 qualification, you dick? The primary condition with pseudoxanthoma elasticum, PXE, is the progressive fragmentation and calcification of elastic fibers in the connective tissues, which directly affects three main systems: the skin, the eyes, and the cardiovascular system. Primary manifestations of calcification in PXE. Cardiovascular system. Arterial calcification, mineralization of the elastic walls of small and medium-sized arteries narrows the blood vessels, reducing blood flow. This causes peripheral artery disease, which commonly leads to intermittent claudication, severe cramping, and pain in the legs or calves during physical movement. It also increases the risk of early cardiovascular issues and gastrointestinal bleeding. Ocular system. Brooks membrane calcification. Calcification of Brooks membrane in the retina causes it to crack, forming angioid streaks. This leading to leaking blood vessels, scarring, and progressive, severe central vision loss. Dermal system. Skin calcification, elastic fiber breakdown causes yellowish papules, skin laxity, and sagging, typically on the neck, armpits, and groins. Direct link to the Texas qualification. Because PXE fundamentally causes systemic arterial calcification that limits blood flow and directly leads to persistent, debilitating leg cramps and vascular damage, it operates as the physiological root cause of your chronic pain. Under the Texas statute, you qualify for the compassionate use program because that calcification presents as documented, intractable chronic pain, such as claudication and sciatica, which fulfills the state's legal mandate. Did you think you could creatively come up with just a one-sentence structure where I could tell people to F asterisk 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 off, and don't tell me about me without having to be so damn rude because they don't know PECs? And the fact is you do no PXC and calcification qualification is right in there, and I am so tired of lecture. So give me a sentence, 'cause I'm tired of all you people lecturing me. I manage a complex connective tissue condition called PXE that causes systemic calcification and severe pain, so I am not looking for external advice or lectures on my health. Gemini is AI and can make mistakes.